Hey guys, we're back, myself and Dr. Valle. We wanted to touch base with our patients, and we know there's a lot of questions and we're receiving them every day about where this new Delta variant is going and what's the status of COVID in our community, and just go over some of the treatments and what our recommendations are at this time. We can tell you that we do see that there's no longer an increase in cases, but it's still very prevalent in our community, and we're still advising people to be cautious. We see our hospital numbers going down a little bit, but we don't want our patients to let down their guard, and we want everyone to stay careful, and we want to be the first person you go to should there be any concern.
We've been very fortunate, obviously, been very proactive in terms of vaccinating our patients, really from the onset of the vaccine being available. So that's actually a testament to how seriously our patients take their health. A huge percentage of our patients have been vaccinated, with very rare exception. Obviously the latest information is regarding the need for a booster in those patients that have already been vaccinated. Most of our patients, because we were so proactive, were vaccinated in anywhere between January and March of last year. That's when they completed their second shot of either the Moderna vaccine or the Pfizer vaccine. And of course, we did have a few patients that chose the Johnson & Johnson vaccine, although far fewer. So in terms of the current thinking with the boosters, it does appear that, particularly with the RNA vaccines, Moderna and Pfizer, but Pfizer in particular, there does appear to be some waning immunity that happens after about 6 months of having completed the two-shot series. So a lot of that data is based on information out of Israel, where they used almost exclusively the Pfizer vaccine in immunizing their patients. Based on that data, we're basically seeing that after 6 months, particularly in older patients above 65 years of age, they're starting to see a marked decrease in the immunity, particularly in neutralizing antibodies. Fortunately, it still seems to be very protective towards severe disease. So really what we're seeing with the waning immunity is really in those neutralizing antibodies, is towards any disease, mild or moderate. So again, it does appear that a booster is going to be indicated if you completed the series more than 6 months ago. So the sweet spot appears to be anywhere between 6 and 8 months. Again, most of this data is driven with the Pfizer vaccine. Moderna seems to be a little bit better. The FDA right now is not really making any recommendations regarding Moderna. Patients that were vaccinated with Moderna originally, it's mostly Pfizer, but I suspect that Moderna is going to have kind of similar recommendations eventually. So again, if you completed your vaccine series, let's say around March of 2021, you're coming up on the 6-month mark, and so as soon as the FDA approves it, you should be looking to boost.
So with our patients, we actually prefer that before they consider any treatment, they call us. We want to be the first call for anyone that is concerned with having COVID or having contracted COVID. We'll do our own testing for our patients in our office or in the building. But our recommendations are based on individually, knowing our patients and knowing their risk factors and whether or not it should be anywhere from just observation and over-the-counter medications with quarantining. Obviously vitamins, as we recommended in the beginning, with vitamin D and zinc and vitamin C, to setting patients for monoclonal antibodies to prevent hospitalization. But again, that's going to be a decision that we'll make with our patients, and I think it's important that we do guide you in the care and treatment.
Supporters of masking. I think masking, obviously it would be ideal if everybody had a high quality mask, right? If everybody was able to get their hands on N95 masks that we use, Early on in the pandemic, there was a lot of talk about, masks, we don't need masks, what have you, but the reality is that it does help decrease the transmission of the virus between people, and in terms of protecting yourself, if you have a high quality mask, like an N95 mask, you're going to lessen the likelihood of getting infected. How do we know that? Because we're in the hospital and we see doctors going into active COVID units, taking care of COVID patients on a daily basis, and they're masked and they don't get COVID. So the masking does obviously work, but it has to be a good mask and you have to wear it correctly, and that's unfortunately where the issue kind of comes. So there's two issues with masks. One is, are you preventing yourself from getting sick? And the other one is, are you potentially decreasing the likelihood that you're going to spread it to others if you have it? I think that for the general population, it's that second point that matters. We're hoping to try to decrease the amount of community spread of the virus at any given time. And so from that standpoint, I think masking is definitely appropriate. In terms of the social distancing, I think that the other thing that's been clearly proven now with this virus, as opposed to what we knew or thought about early on, is that really it's not a contact issue. It doesn't have to do with although washing hands is very important, that's not the main mode of transmission of this virus. We seem to think that it's very small particles, that kind of float in the air. And so for that reason, anytime you can be in an outdoor exposed environment that has very good ventilation, you're much better off than being in an indoor air-conditioned environment that is recirculating the same air that may have that virus in it. So for that reason, our recommendations to all of our patients is, if you're going to go out to dinner and if you're going to go, socialize, great, do it. It's important. It's a big part of life. And sadly, one of the things that we've kind of lost out over the last year and a half, but if you're going to do it, try to do it in the best environment possible.